it's a complicated case. I mean, that's one thing. You've got a couple of different problems going on there. Perhaps, it sounds like in the history, some dog-directed aggression, some owner-directed aggression. But I think the things that you first have to look at, and you mentioned that this particular case was an older dog, and we may not have an exact age because it's a shelter dog. And so when I think, though, about an older dog that's having changes in behavior, I'm really going to look at the medical components for that particular dog. Is it in pain? What else could be going on medically that maybe just makes it more irritable? Does it have problems with hypothyroidism? And there's a lot of debates about the influences of thyroid on behavior, and I certainly am not one to think that every behavior problem is thyroid related, but in an older dog that starts to have problems, I would certainly screen for that and see if we have some low thyroid problems. So I think in this case, a full medical kind of evaluation, maybe some screening blood work, certainly a orthopedic exam, those types of things would be indicated for this pet. I know you have a history of food-related aggression. And by the way, best predictor of who future behavior is past behavior. So they adopted this dog with a history of aggression. And so, the dog has probably learned over time that aggression is a good coping mechanism for what it perceives as a threat. So someone coming towards its food bowl, it uses aggression, they usually back away. And if they don't, the dog will escalate its level of aggression until they do back away. And usually the dog wins ultimately if it goes to the bite. One of my actually favorite things about dog bite laws is that you can't, we have a quarantine after a dog bite for the rabies. And I actually really like that because owners are at the point, and I don't blame them, of getting bitten by their dog. They get really reactive and are very emotional. And so I actually like the quarantine period because it gives people a chance to maybe calm down a bit. And one of the things that mentioned in the history is that these owners had been trying to avoid the triggers. And despite that, they got bitten with a trigger. And so as the practitioner, what I would then look at once I'm screening, maybe even concurrently with screening out the medical problems, is really look at what does avoiding a trigger mean in this situation. So, like for example, maybe they still feed the dog in the family room, but they don't go up and put their hand in the bowl of food. But maybe for this dog with a history of food aggression, maybe this dog has to be fully segregated behind a closed door when it's eating so that the dog can truly relax. With the inner dog aggression, once again, I don't have specifics of the case, so I don't know, but I'd be looking at what's triggering that. Is it when the other dog gets too close to the owner? Is it when the owner dotes on the other dog and gives it attention? Is it got to do with maybe possessions like the bed or something with food with the other dogs? So I'd really be investigating that and really trying to figure out, are they really doing all they can do to avoid those triggers? And most of the time the answer to that is no, that you can give them additional advice. And sometimes I think people are just so kind of in their routines and patterns that they don't see it. And an outside objective person coming in and saying, you know what, we could change this. And people are like, oh, that's so simple. We never thought of that. And so I think you can be really helpful on looking at those cases and saying, okay, how can we minimize those triggers even more? We're maybe not doing the best job at this time. That said, if you really think they are doing a stellar job and you can't provide anything else, I do think you have to consider safety of the human members of the family and the other pets. And if that dog is real risk, then difficult decisions come into place. Like, is it fair to anyone to have this dog in the environment, and is it safe? Most of the time, I feel like we can work around it. If we take it up a notch, we can do management to keep the dog safely in the home. Then, once you've kind of addressed those two things, the medical and the avoidance, then we can think about, okay, what is our plan for treatment for this particular pet? Is there a desensitization and counter-conditioning model that we can do that will really not take away all possibility of aggression, but really minimize the risk of aggression? I'm really clear with my clients that I do not cure aggression. Aggression is an absolutely normal behavior in dogs. But what I can do is minimize the likelihood, perhaps, that dog can show aggression in the context of whatever its triggers are. And so when I look at that, I, once again, may develop a specific program for this dog when we get more information about the triggers. And maybe I'll do management long-term, especially with food-related aggression. Maybe we say we feed the dog behind a closed door until it dies. And you know what? That could be fabulous for everyone involved. And so once we work through that process, we may actually eventually look at other ancillary treatments if I think the dog's anxious, like pheromones or drug therapy even. It's hard for me to say in a case without a more thorough history, but those are all types of things we could look at to address it. So I don't necessarily think they have to get rid of the dog. I see cases like this all the time where everyone ends up it's not only successful, it's actually improved over what they ever thought relationship they could have with their pets.